We're going to start with medial palpations, and this is the tibialis posterior, and we palpate this for a strain. This is the deltoid, and we palpate it for an eversion sprain. This is the medial longitudinal arch, and this is for the sprain of the arch or an arch evaluation. This is the posterior tibial pulse, and this is for vascular compromise. This is the spring ligament, and this is for sprain. Now I will be doing lateral soft tissue palpations. So the ATFL is right here, and you palpate that for an inversion sprain. The CFL is right here, and that's also for an inversion sprain. And then the PTFL is right here and also for an inversion sprain. So the fibularis longus is from here to here, and that's for a strain. And then the fibularis brevis is from here to here, and that's also for a strain. This is the tibialis anterior, and that's for a strain. And this is the lateral longitudinal arch, and that's for an arch evaluation or an arch strain. So I will be doing the posterior soft tissue palpations. So the gastrocnemius is back here, and it's for a strain. The soleus is also back here. That's for a strain. The Achilles tendon slash heel cord is back here, and that's for tendinopathy, rupture, or a strain. And then the watershed region is also back here, and that is for tendinopathy. For the deep peroneal nerve, it goes from here down to the first and second toe, and that's for neurovascular compromise. And then for the tibial nerve, it starts here and runs down the leg, and that's also for neurovascular compromise. So we have the medial planar nerve, which starts from up here and goes to the first and 3/5 phalanges, and that's for neurovascular compromise. We also have the lateral planar nerve, which starts here, comes around, and then goes to the 3.5 to 5 phalanges, and that's also for neurovascular compromise. We also have the posterior tibial artery slash vein, which is runs in the back, and that's for neurovascular compromise and tarsal tunnel syndrome. And then we have the plantaris, and it's here and down, and it's for the strain. So now for anterior palpations, we have the fibular artery, which goes here on the outside and goes to here. That's for neurovascular compromise. For dorsalis pedal artery, it goes from here to here, and that's also for neurovascular compromise. The saphenous vein goes from here, and it's deep, and then to the gracilis, and that's also for neurovascular compromise. And then we have the interossi membrane, which is between the tib and the fib, and that's for dislocation, a fracture, and a syndesmotic sprain. So now I'll be doing the planar palpations. So this is the metatarsal arch right here. It's also on the bottom, and that is for evaluating the arch and an arch sprain. So now for the flexor digitorum brevis, it starts up top, and it goes down and into these toes, and that is for a strain. And then the flexor digiti minimi starts here and runs into the 5th metatarsal, and that's also for a strain. For the flexor hallucis longus, it runs from here to here. For the abductor digiti minimi, it runs from here to there, and that's for a strain. And then the abductor hallucis runs from here to there, and that's also for a strain. So the next three are all for strains. So the lumbricals are right here. The quadratus plantae is from the calcaneus to the midfoot, and that's also for a strain. And then the planar interossi is just right in here. So now I will be doing the dorsal palpation. So for the extensor digitorum, it goes from here and runs into the 2 to 5 phalanges, and that is for a strain. And then for the dorsal interossi, it goes from here to there, and that is also for a strain. And then for the extensor retinaculum, it's right here, and that's for a strain. For the extensor digitorum longus, it starts here and goes to here, and that is for a strain. And then the brevis is from the back to here. That's also for a strain. And then the extensor hallucis longus is from the medial to the big toe, and that's for a strain. And then the dorsal pedal pulse is right here, and that's for neurovascular compromise or a large leg injury, and you'll compare it bilaterally. So now I'll be doing the medial bony palpation. So this is the medial calcaneus, and that's for growth plate problems and Sever's disease. And then the medial malleolus is right here, and that's for a fracture or dislocation. The navicular is right here, and that's for a fracture. The cuneiforms run here, so the intermediate, the medial, and the intermediate, and the lateral, and that's for a fracture. And then the sustanaculum tali is right around here, and that's for a spring ligament or a deltoid ligament sprain. So now I'll be doing the lateral bony palpation. So the lateral calcaneus is right here, and that would be palpated for a growth plate problem or Sever's disease. This is the lateral malleolus right here, and that's for a fracture or dislocation. This is the fibula right here, runs here, and that's for a fracture. The cuboid is right around here, and that is for a fracture. The base of the fifth metatarsal is right here, and that's also for a Jones fracture or metatarsal fracture. And then the sinus tarsi is the gap between the talus and the calcaneus, so it's right around here, and that is for sinus tarsi syndrome. So now I'll be doing the anterior bony palpation. So the fibular head is right here, and that is for a fracture or dislocation. The fibular shaft is here, and that's for a fracture. The tibial plateau is up here, and that is for a fracture or dislocation. The tibial shaft is right here, and that's for a fracture. The talus is right here, and it sits under the tib and fib, but on top of the calcaneus, and that's for a fracture or dislocation. The talar dome is, if he slightly flexes, there's a little indent, and it's right in here. And that is for a dislocation fracture. And then the mid-tarsal joints are between the cuboid and the calcaneus, and that's for a sprain. For the bony palpations posterior, the calcaneal tuberosity is back here where it inserts, and it's for an Achilles rupture. So for plantar palpations, the calcaneus is back here, the calcaneal border is right here, and the sesamoids are on the bottom of the foot. There's two of them, and that's for a dislocation or sesamoiditis. And then the phalanges for dorsal palpations. So phalanges are here, the toes right here, the metatarsals are here, and this is for fractures. The Lisfranc joint is where the metatarsals meet the tarsals, so it's right around here, and this is for a Lisfranc injury. And then the MTP joint is where the metatarsals and phalanges meet, so they're going to be right in here, and that's for a sprain. And then the ip joints are between the phalanges, so they're going to be in here, and that's for a strain.